Good morning. Today we'll be talking about endometriosis and its effect on the life of women. Thank you very much for coming onto the program. It's a pleasure to have you, Dr. Toyin, once again with us.
Thank you very much for having me, Dr. Pamela. It's a pleasure to be back.
Okay, so we're talking today about endometriosis. What is endometriosis and why should we be concerned about it?
Okay, so endometriosis is a benign condition, all right? So it's not cancerous. That's the first important thing to get across. But it's a gynecological condition that affects women of reproductive age. And it's basically an inflammatory, like a chronic inflammatory condition where you basically find endometrium outside the womb. Now, endometrium is what we call the lining of the womb. That's typically where you bleed from during your periods, and it's meant to stay inside the womb. But with endometriosis, you actually find it deposited outside the womb in different places. And then this essentially every month when you bleed, these little tissue areas outside the womb also bleed and can give you, some issues. Some women have no symptoms at all, actually, but those who do have symptoms have mainly pain and their fertility affected. All right. So, it really is quite a burden. And we don't really know the real incidence, maybe about between 5 and 20%. We don't really know, but we do know that about half of women who have fertility challenges will have endometriosis. So it definitely is a burden, on women who are of childbearing age who are trying to have babies. And like I said, not everybody has symptoms, but when you do have symptoms, it is a real challenge because you have a lot of pain, it can affect your fertility, and also how do you manage, those symptoms, either the pain or trying to get pregnant. That's where the gynecologist comes in.
Okay, so now this, for me, just sounds odd. Why would tissue that's meant to be inside the womb start wandering around the place? And where does it wander to?
Right. So, well, again, not known definitively, but there's definitely a theory, something called retrograde menstruation. What that means that, when you have your monthly bleeds, obviously you're meant to shed that lining and it comes out, from down below to the outside world. But some of it tracks back up through your fallopian tubes and then out into your pelvis. And that's obviously not meant to happen. So then get these little deposits of tissue, within your pelvis. So typically you'll find it, on the pelvic walls. You might find it on the ovaries. Some reports have actually been shown you can actually get endometriosis in your lungs, because it can be carried that far. It's quite rare, but it can happen as well. So obviously these little deposits you have in the wrong places. Like I said, every month, when you have your bleed, they also bleed because they're under the effects of estrogen, which is the normal hormone, one of the female hormones, that you get every month. And that bleeding in the abnormal place is what causes all the problems. So if you've got it like in your pelvis, it can cause a lot of scarring and scar tissue, for instance, which is not normal. If it's on your ovaries, it can actually form, these cysts called endometriomas, and again, that also affects how well the ovary itself functions. And that's sort of the challenge with the infertility side of it as well. Yeah, so that's how it gets where it shouldn't be.
So who's susceptible? How can, is there any way that you can prevent yourself from getting this, or can anybody get it? Or are there specific people with specific habits or specific tendencies that get it? How do we know who gets it? And how can we, if we have a tendency to get it, prevent ourselves from getting it?
Yes, so that's one of the challenging things with endometriosis. So any woman of reproductive age essentially is susceptible because, like I said, it's driven by hormones. All right. Now, women who are menopausal, they don't get endometriosis, but the effects that they've had from before can carry on into their postmenopausal life. But they don't get it new, when you stop having your periods. And unfortunately, there's no risk factor as such. There's no prevention as such. Typically what you'll find is, maybe in your 20s or something, you just have really, really horrible, maybe you've always had really horrible periods, lots of pain, pain's the main factor, not even so much heavy, but really bad, pain during your periods. If you're sexually active, you might have pain during sex as well. And then that might be what sort of takes you to your doctor back and forth. And then, one starts looking into it, trying to find out, what this could be. trying to get a diagnosis.
But most of the time, it's picked up when a woman's trying to get pregnant, isn't it? And maybe she fails to get pregnant, I think. Or is it picked up at any other time? Maybe you should let us know.
Yeah, so like I said, so some people that have no symptoms at all. All right. So there's so they might have it, when you have a look at their tummy with a camera, for instance, but they've not got any complaints, they've not got any pain, they're not yet trying for a baby, so they don't know they've got it. Like you said, maybe when they start trying for a baby, they're having challenges getting pregnant. And then in the course of investigations by the gynecologist, maybe a scan shows the cyst of the ovary looks very typical. It's very typical appearance that is always, this related to endometriosis, or maybe because they've got a lot of pain, they have keyhole surgery, laparoscopy, and then when you have a look in the tummy, you then find these, they look like little sort of dark, like burnt spots, essentially. And that, typically, again, is endometriosis. So that's usually how you figure out you've got it.
So if you have endometriosis and you're having difficulty getting pregnant, because obviously pain is obviously a terrible part of it, and people would want relief from pain. But I would suspect that, they would take painkillers, etc. But the really confounding issue is if it's causing infertility, is there a way that infertility can be treated? Is there a way out? Can you treat it and treat the infertility and get people pregnant with endometriosis?
Yes, absolutely. So you can. So yeah, if you're struggling to get pregnant, like I said, you'd have gone to see a doctor or a gynecologist or fertility specialist, and then you have investigations done like scans. Now again, the only kind of endometriosis you'll see on a scan is when you've got the cyst, something called an endometrioma. All right, you don't see the little typical black spots on scans. All right, but if you'd had if you have a cyst, you'd see that very typically, and then you got to decide, what should we do with these cysts. All right, because if you're having no symptoms, if you have no pain at all, and it's more just a challenge, in getting pregnant, then you have to then consider: do we want to try and remove the cyst to improve the function of the ovary, or not? Because the risk of any surgery on the ovary to remove a cyst is that you can actually reduce the function or the reserve, the ovarian reserve, the ability of the ovaries to produce follicles and thereby eggs. So it's always a really nuanced conversation between you and your patient to try and see what the best thing is in terms of treatment. Obviously, if it's very, very large in terms of size, then then you probably recommend that you want to be doing something about trying to remove that cyst. But we know that a lot of people with endometriosis, because they already have reduced fertility, they tend to end up having some kind of IVF treatments to try and help them get pregnant. And then if you have a very large cyst on your ovary, for instance, you might recommend removing it so that it's very easy for us to access those ovaries to get the eggs that we need as part of your IVF treatment. So there's definitely hope if you have endometriosis. It's it is a challenging chronic condition, but it's to seek help early if you're unsure why you're having horrible periods or why you're not getting pregnant soon, and then obviously we can then help in terms of trying to find out what it could be and recommend.
Okay, so what's the best kind of treatment for patients with endometriosis trying to get pregnant?
So invariably they'll require IVF, in vitro fertilization, to achieve pregnancy. Because invariably because the endometriosis, like I said, has affected their ovary in terms of reducing the ovary's ability to produce follicles and good quality eggs that they can get pregnant naturally. And also if they've got these little spots of endometriosis, like I said, within the pelvis, which forms scar tissue, that can actually affect the tubes as well. And if the tubes are not functioning, then definitely IVF is what you need to achieve pregnancy, because if your tubes are not working, there's no way the egg and the sperm can meet, as they should.
So what kind of success rates do you get with people with endometriosis? Is it the same? I know you have a lot of experience at the British Clinic with treating patients like this. And another question that has come through is there any particular age that is affected by this?
So in terms of success rates, we know that IVF itself is not 100%, but we know that success rates range between sort of 35 to 45%. which is comparable to international standards, and that's what we're quite proud of. But the reality is, if you have endometriosis, even with IVF, your success rates are going to be a little bit lower. You still have a chance of getting pregnant, but just the fact that you've got the endometriosis just lowers your success rate with IVF, even as a tool to help. And like I said earlier on, in terms of those who are affected, it's usually women of reproductive age, so your 20s and 30s, essentially.
Okay, in terms of the age. But that's a bit distressing. So IVF at the British Clinic is about, what, 35 to 45%, and you're saying it's lower for women with endometriosis. But if you've extracted the eggs and you're already placing it in the womb, why is there a lower risk or a lower chance there? I would have thought that it would be the same chance for anybody that age.
Yeah, so because you can't cure endometriosis, okay, so you can't ever take it away. Okay, you always have endometriosis, and it is and it's an inflammatory condition. It's a chronic condition, so it does affect things on the, how can I put it? It affects things on the cellular level, I guess is what I'm trying to say. So because you can't ever remove it. So even though you've maybe cleared those cysts away and done your IVF, the fact you've got this inflammatory condition inherently in you is probably what slightly reduces your pregnancy rates compared to someone who doesn't have endometriosis. Undergoing IVF.
Well, yeah, I think so. But anyway, I think it is encouraging, though, that you can get treatment, you can get pregnant with the endometriosis. But I mean, how do you treat it? So how do you reduce the symptoms? I mean, is there a way to reduce the effect at the cellular level that you're talking about?
So unfortunately, like I said, you can't really change that. All you can do with endometriosis is really just treat the symptoms. So the symptoms are either pain or infertility, the most common symptoms. So if it's pain, there are different things you can do to treat that, depending on how severe the endometriosis is. So if you've got massive cysts, you try to remove those cysts. If you see the endometriosis on keyhole surgery, you burn it. You can do laser or burning it away, again, to try and reduce those symptoms. Some people have endometriosis that affects, other structures like their back passage, for instance, or their bladder, and then that's quite severe, and you need a specialist sort of, endometriosis expert, laparoscopic type surgeon to try and literally, cut out those endometriotic nodules, as you call them, and hopefully, again, that should help relieve pain, essentially. So, like I said, you treat the symptoms, but you can never get rid of the underlying chronic inflammatory process that's going on.
It's a tough one, Mrs. Fapohunda. Can you tell us, you have a foundation to do with endometriosis, and I know you founded it based on some personal experiences of yours. Do you mind sharing with us those experiences and telling us why you started your foundation?
Thank you, Dr. Pamela. It was because of my personal experience with endometriosis that I founded the foundation, like you rightly said. My experience started at the age of 13 when I had my first period. I wouldn't know if it was endometriosis then, but I had a really terrible pain with my first period. I was in school. I couldn't wait for my mom to come get me and, for me to get to the hospital because I didn't know what was going on. The only difference was that I was bleeding and she had told me about menstrual period. So it took 16 years before I had my diagnosis. During the 16-year period, I went from one hospital to the next one. My mom took me to so many doctors, trying to find answers to what was wrong with me because I knew something was definitely wrong. My friends didn't have periods with so much pain. Once my period started, I had to be taken to the hospital. I had to take injections. Because I would vomit a lot. Sometimes they had to give me some drips, IV infusion. I stooled a lot as well. And I had a lot of pain that was it went down my legs, my back. In fact, I would lie on the floor, I would cry, and it continued like that for 16 years before the diagnosis came. And after the diagnosis came, it was my experience was different because at that point, we knew what we were dealing with. So this is what came about the foundation, Foundation.
So why did you, or how did you get your diagnosis made after 16 years? What was the trigger?
Yes, okay. So before the 16th year, I was 29 at the time I had my diagnosis. But before then, visiting different hospitals, at some point, a gynecologist saw a cyst on my right ovary. And they wanted to take it out, but I didn't want them to. I was afraid. I thought, no, I didn't want to undergo a surgery. Another doctor saw it, and it was the same thing. I still didn't want to take it out. But the third time, I went on holiday to visit my sister, who just had a baby, and the unwanted guest had sneaked into my box, into my luggage. So I was rushed to the hospital when my period started. And the doctor said, this had to be investigated further, because I saw a GP and he reckoned I had to see a gynecologist. So he referred me. And then in that, the process started. Listened to my story, told him about my experience in 16 years, and told him about the cyst. Although he still investigated, he took me to another room where he did the scans and all of that. And he was able to see the cyst. The cyst was very big at this point. I don't know, but I can't remember the size, but it was a really big cyst. And I had a lot of pain because of the cyst as well, because I think maybe doctor mentioned maybe sometime it could turn and twist.
Yeah,
and
twist. Yeah.
Yeah, I had a lot of sharp pain. I would scream and all of that. So he gave me some hormonal medications at that point to see if it would help. But he had mentioned that all of the symptoms sounded like something called endometriosis. But he cannot tell me that is what it is until they had to take me to the theater and check through a laparoscopy procedure. And they will still need to check to send a sample to the pathologist. So I said, okay. And I went on taking the medication, but it didn't help. Went back to the doctor and he suggested we would actually have the examination, and that in the process that they had to take out the cyst. And in the process of taking out the cyst, they would also be able to check and confirm if it is endometriosis. So it was 2 in 1, which eventually was done. And I was diagnosed with a stage 2 at that point. So after my diagnosis, treatment started, which didn't offer help. I tried a whole lot of treatment, hormonal treatments, different types, dealt with, so much, but it still didn't help. But because of that experience, the late diagnosis, I thought it was important that I felt awareness is needed for early diagnosis. All the time I was in school crying, missing school, missing exams. What my friends did in 3 years, I had to wait 5 years to complete it. There was also stigma, because some of my friends said something was wrong with me. They felt, why is my pain so unusual? Why do I have to go to hospital every time? Why am I disturbing my parents? I'm just being a burden on them. They had to take me to the hospital. And even, but thank God I was not, affected mentally. Because I felt I could have been really, because it set me back a lot, and also affected my fertility. I couldn't have babies like, the natural conception, although I still don't have kids yet, but yeah, I have my embrace.
No, thank God. I think these things are just so important that we allow people to know about them and know what they can do about it. So I think I'm happy you've shared the story with us, and you've actually confirmed a lot of what Dr. Toyin was actually saying, but it's tough, but it's much easier now. You know exactly what it is and exactly how you can manage it. So I think that's an important thing. Dr. Toyin, can I ask you then, how at what age would you recommend? Because at 13, from 13, she's had the problem. would you recommend doing laparoscopies as early as that? Or, I mean, if there are people listening out there, and maybe there's a mother who's similar to Mrs. Fapohunda's mother, thinking herself, you know what, every time my daughter has this pain, maybe she's just, 17, 18 now, what do you think she should do? How do you think a mother out there or grandmother out there who's listening and thinking, you know what, I think my daughter has this. What do you think they should do? How can they handle it?
Yeah, and that's such a good question. And as I was listening to Mrs. Fapohunda, it was it's so painful because her story is not atypical. The time from first symptom to diagnosis can really be decades. Because there's a lot of I guess it's like she said, she was very young when she started getting these pains. So people are very reticent to go and jump in, rightly so, to do anything too dramatic. But in terms of what to do, if you're at that younger age and you're having this constant, horrible painful periods, the recommendation is actually just to start kind of empirical treatments. Okay, so some sort of hormonal manipulation, and that's usually by putting you on a pill, combined pill. Now again, a lot of mothers will be like, "Oh, I don't want my child to go on the pill." She's like 14. Why should she be on the pill? And there can be a lot of taboo and stigma attached to that because people assume you're on the pill because you're doing naughty things you should not be doing, which obviously is not true, for instance. But actually, and I'm sure Mrs. Fapohunda probably was placed on similar things initially. So you try and treat it empirically first. You don't jump in and start doing operations and cutting people open or whatever. So you usually go on like a combined hormonal pill, and take it maybe for like 3 months, back to back, because what you're trying to basically just dampen, your ovarian activity, just kind of shut it down. So you're not getting cyclical, peaks of estrogen and stuff to try and drive what's going on with this endometriosis. So take it for like maybe 3 months, then have a break to have a bleed, and then do it for like another 3 months. So that's usually what you tend to do with someone who's a bit younger, and that's usually what happens. It kind of gets them through school years initially, and then obviously maybe when they're a bit older, you can then maybe start. If that's not working, you might want to start thinking, right, do we need to do anything different? Do we actually need to look into your tummy, perhaps, or can we still carry on with something from a hormonal point of view? Maybe when I was training, or for instance, laparoscopy was probably the gold standard for diagnosis. That's the only way you can really diagnose. But now we have so much better imaging techniques. They can actually pick up things on different types of imaging without having to go and perform a procedure and operation to make a diagnosis.
Now, we don't have much time, but I just want to ask Mrs. Fapohunda one more question before I come back to you for last word. Mrs. Fapohunda, so what does just in a few words, because we've really run out of time, what does your foundation do? And if there are people listening who want to support your foundation, how can they reach you?
Okay, thank you, Doctor. So the foundation go to local communities. We visit schools, high schools in particular. We create awareness about endometriosis. And when we visit the schools, we engage the students about the experience with menstrual pain. We also speak to the teachers, the principals, so that they can give support to the students who present with such symptoms. There are students that have very painful periods, and we've had some principals tell us that they do not believe that anyone could have that kind of pain with their period. So we advocating support for girls and for people who are in employment, for women in employment, so that they can be supported, and the general public will understand that there's truly something called endometriosis, that people who present with symptoms can have a really, really excruciating. We are on Instagram, and we actually have a phone number that you can reach. We've got email as well. That the email address is info@eafoundation.ng, and the phone number is 090-8064-0370. And we are Endometriosis and Adenomyosis Foundation, E&A Foundation, on Instagram. Thank
you very much. Dr. Toyin, any last words, quick last words for our listeners?
Yeah, so I think just be aware that there's something called endometriosis. Having horrible, painful periods is not normal. So if you do have more painful periods, do get that looked into by a gynecologist, or if you're struggling to get pregnant, again, get seen by a fertility specialist, because it could be maybe endometriosis that is the underlying factor. And there's definitely hope and definitely ways to overcome that to ensure that you can actually complete your family as you'd like to.
Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.